Hi, my name is Greg Fell. I'm Director of Public Health for Sheffield. This is the Situation and Epidemiology report of the 21st of December. Somber, in a word. It's very clear that Omicron is here. It's growing very, very, very rapidly in some cities in Yorkshire. Sheffield is one of those cities. That is an unstoppable rise, probably. Don't know how long it will last, but it's definitely here now, and it's going up very, very, very quickly, in a way more quickly than anything we've experienced to date. Still lots of things we don't know, but what we do know, sadly, there's not much good news. You'll all have heard the Prime Minister warning us on a number of occasions over the last couple of weeks. So it's unknown where government thinking will go on this after Christmas, but for now our rates are going up very quickly. Mainly youngish adults. That will not last. It will get into the whole population. There's no two ways about that. There's not much sense that the overall data is indicating a shift in age profile or a shift in incubation period. What's happening now is mainly youngish adults, and that's just on account of who's out mixing most. So the base case assumption is that it will act like Delta and have the impact of Delta, but with the exception of immune escape and transmissibility, which I'll come on to in a minute. Frighteningly quick doubling times. It's remarkably infectious, and it has a massive transmission advantage over Delta. And remember, Delta had a massive transmission advantage over Alpha. Two things that I would encourage people to read if you want the full skinny on the science. Sage 99, the most frightening set of Sage minutes I've read, and non-pharmaceutical interventions in the context of Omicron, dated 15th of December, and we'll put the link on the end of the video. But both are well worth the read. So on the key points of the situation update, doubling every 2 days. It's nationally, it's almost certain that there are now hundreds of thousands of Omicron infections per day, and currently observed numbers of people being admitted to hospital in the UK, probably about a tenth of the true number because of the data lags in hospital reporting. And what we've seen in some parts of South Africa is that there are high levels of infection that is leading to high levels of hospitalizations, despite the younger population in Southern Africa, South Africa, and high levels of past infection. It might be slowing a little bit, but probably too early to call that. The base case assumption is that it's not less severe. I hope it turns out to be less severe. It's probably not more severe. Even if it is less severe, the sheer numbers of a much more transmissible virus will lead to more people being infected, and that will lead to more people being poorly, and possibly unsustainable pressure on the NHS and social care. It's worth a careful read of the Sage note. But the timing of what we do and the impact of what we do really matters in terms of protecting those that are most likely to be severely ill. So it's important that we all take heed on that one. The sooner we do that, the better. And again, Sage is abundantly clear on that one. Slowing the wave of infections insofar as we can will allow more people to receive booster vaccinations before they're exposed to Omicron, and that obviously will prevent and not just delay some hospitalisation, some death. So the effort on boosters is literally saving lives. I then encourage us all to heed that, and one, slow infections so that more people can be boosted, and two, if you haven't yet been boosted, please be boosted, and I'll come on to that in a minute. Immune escape, people talk to me about this. The evidence is clear. There is some immune escape with this one. The evidence suggests a significant degree of immune escape, with much higher levels of reinfections being seen with Omicron, 8 to 9%, compared to Delta, 1%. So 1% of people who had Delta would be reinfected, and that's, we think, up to 8 to 9% with Omicron. Vaccine efficacy against severe disease and death from Omicron remains uncertain due to small numbers of people who've been severely poorly to date, but it's looking like 2-dose plus booster will provide pretty good, nearly as good protection against severe disease from Omicron than compared to Delta. Not quite as much. It's never too late to get fully vaccinated if you haven't already been done so. If you missed the call first time round, you didn't get round to it, whatever, never too late. You will not be judged in any way, and there is no scenario in which having some vaccine immunity is better than having none. So get on that path as soon as you can. So what to do? The same broad package of measures, sadly, most important of which is vaccination, I'll come on to at the end. But the non-pharmaceutical interventions are broadly the same. Testing if symptoms and isolate. Regular use of lateral flow devices, especially prior to mixing, especially prior to high-risk mixing, as close as possible to the event time-wise. Lateral flow devices can be really, really helpful at an individual level. They can also be helpful at a group level. And my suggestion is if one person from a group that's going to an event test positive in that context, then the rest of the household would probably also test positive, given what we know about secondary attack rates. Even if the test is negative, if you have symptoms that you think might be COVID, don't socialise. There is still potential for flu. There's still horrible nasty colds going around, which I wouldn't wish on anybody. So don't spread your other respiratory bugs around if at all possible. Social contacts, gatherings and social contacts. You're far more likely to get this from people you know, but you can still acquire this from gatherings, contacts, going to restaurants and pubs, etc. So the Chief Medical Officer's call to reduce social contact and reduce the risk with that social contact is entirely sensible. I get it's hard, it's Christmas, and we all want to be out, but reducing social contact does make a difference. Prioritise the contacts that you most want to keep. Risk manage those contacts, mask wearing, testing as close to possible as the event. Indoors versus out. Think about vulnerable people in the chain. There are lots and lots of separate gatherings does present a greater risk for multiple spreading events. Reducing the duration of the contact, the distance between people, limiting the contacts to people you would normally meet with. I heard an interesting suggestion from a professor recently. A simple rule when apply when thinking of meetings is ask the oldest person what they would do. The risk of them meeting up is many times greater than the risk of probably most other people in any gathering, even if all fully vaccinated. So ask the oldest person what they would do in that circumstance. Lastly, ventilation. We think there's a lower infectious dose and/or a higher viral load that massively increases the risk of airborne transmission, which was always a thing, but probably more of a thing now. So open the windows, get maximum ventilation in. If you can meet it outdoors rather as opposed to in, then please do so. And masks. The fit of the mask is important. The tighter, the better. And over the nose, masks that aren't worn over the nose are basically rather pointless. There may be some changes in policy and approach over the next few weeks, but the basic fundamentals definitely aren't going to shift on that one. Lastly, it remains critically important to minimise spread. It remains critically important to protect those most vulnerable to severe illness. It's great that it looks like vaccine protection against severe disease will broadly hold up. Hence, the strong push to get as much vaccination done as quickly as possible. Particular focus on boosters for those that are fully vaccinated, but also there are plenty of people coming forward that haven't yet had their first and second doses. Please do so. You just won't be judged in any way. It is never too late, and there's no scenario in which not having any vaccine protection at all is better than is worse than having none. Sheffield is full of vaccination clinics right now, a whole range of options for walk-ins, for booked appointments across the city, and credit to those who've made that happen, because that hasn't happened by magic. That's been a humongous logistical effort by lots of people over the last couple of weeks. Please do make a bit of time to go and get vaccinated if you haven't already done so. There's plenty of walk-in capacity. It is never ever too late, and as I say, it's good that being vaccinated will help, but vaccination alone isn't enough, and we will all need to think carefully about reducing our social contact and reducing the risk with that contact over the next couple of weeks. Apologies, it's a somber Christmas message, not one that I wanted to be delivering, and not one that I thought I would be delivering. I will say thank you to all of you who have stuck with this programme over a very, very, very long period of time now, and hopefully after into spring we'll see an easing of the situation. Thank you.